Hello everyone, my name is Daphne Viale and today we will be investigating rubeola and parotitis. So the objectives for today, first we will define and explain, understand and define each condition and its cause. Then we will learn to apply each condition to sports and how they may affect performance. And finally, we will learn how to treat and prevent Find how to treat and prevent each condition, both short term and long term. So, rubeola, also known as measles, is an airborne virus that can lead to severe complications and even death. It is caused by the virus rubeola, and it is one of the most contagious diseases. It is most common in children, and measles begin infecting the respiratory tract and then spread throughout the body. Some symptoms may include high fever, conjunctivitis or pink eye, cough, runny nose, and rashes that start at the face and move downward. They also may include small or white spots inside the cheeks and diarrhea or vomiting. Complications include pneumonia or pregnancy. Most deaths from measles come from complications like pneumonia, and women that are pregnant with measles can result in premature babies. So, rubeola in sports performance. Due to the severe complications of highly contagious airborne viruses like measles, sports medicine physicians require these vaccinations prior to play. Um, because of the close contact with teammates and opponents, athletes are at a much higher risk of these airborne diseases. Measles is much more common in children, so most people should already have these vaccinations complete as they are required for most education systems to be admitted into a school. Um, if infected, however, play will be dismissed until not contagious and they must be quarantined. And remember that every unvaccinated person is at risk. So the next virus is, the treatment prevention for rubeola and or measles. Treatment. No specific treatment. The main focus is to relieve symptoms. This could be, for example, antibiotics for the ear, the eye infection that may come along. Or because measles is very common in malnourished children in other countries, vitamin A supplements may combat this. Hydration is important for people that suffer with diarrhea and vomiting. Some prevention, long term prevention, community wide vaccination is the best long term prevention. Children must be vaccinated as well, which takes 2 doses. Short term prevention is to avoid close contact with others and their bodily fluids. Of course, wash your hands. Our next viral infection is parotitis or mumps. Parotitis or mumps is a contagious viral infection that infects the salivary glands. It is caused by the virus paramyxovirus. It spreads through direct contact with saliva or respiratory droplets. So this one is more direct contact, while measles is airborne. Symptoms may take 2 to 4 weeks to emerge, and symptoms may include swollen salivary glands, puffy cheeks, and a tender or swollen jaw. Like I mentioned before, anyone who is not vaccinated is at risk, especially people who travel internationally to countries where mumps or measles are more common. Parotitis or mumps in sports performance. Because mumps must be spread through direct contact, it is not as contagious or common and even severe as measles. However, there may still be complications with it. Um, Vaccinations are highly recommended for elite athletes. And if infected, athletes are prevented to play. The possibility of cancellation of sporting events when dealing with mumps or measles is high. So, treatment and prevention for parotitis or mumps. Treatment, there's no specific treatment. Like I mentioned for measles, it is best to focus on relieving symptoms. Salivary glands may get very swollen, so maybe icing those glands. Um, Prevention, some short term prevention, like I mentioned for measles as well, preventing contact with bodily fluids and washing your hands. And then some long term prevention, getting vaccinated, of course. Um, the mumps vaccine is also 2 doses, but it is usually given as a combination vaccine that protects against mumps, measles, and rubella. This vaccine is known as the MMR vaccine, and most children are required to get it. Um, Thank you for watching my presentation today on rubiola, measles, and parotitis, mumps. I hope you enjoyed watching, and these are my references. Thank you.